Hello, I'm Andrew Faniku. I'm the maker of Faniks Baby Sleeper, and I'm here to talk about the three most frequently asked questions about the Faniks Baby Sleeper. The most frequently asked question is about safety. Mothers want to know, is the Faniks Baby Sleeper safe? As a pediatrician, my answer is yes. I wouldn't be marketing or selling a product that I felt was unsafe for newborn babies. And as a father, I wouldn't be selling or marketing a product that I couldn't use on my own children, and we use the sleeper on all four of our children without any problems. The CPSC, that's the Consumer Product Safety Commission, they tested our product and it's categorized as an inclined sleeping product. They checked the firmness and the consistency of the mattress and they felt it was safe. It was slanted at an angle that has been shown to prevent reflux, which is 30 degrees. They also confirmed that the cover was non-flammable and was waterproof. I know some mothers have been told erroneously that the slanted position is unsafe for their babies. I'll make a subsequent video to debunk this false premise that the slanted position is unsafe. Mothers, trust your maternal instinct. If the researchers tell you that a position is unsafe, but when you place your baby slanted, they sleep better and they have less reflux, would you trust the researchers or would you trust your own eyes and experience? If the researchers tell you that something tastes sweet, but you taste it and it tastes bitter and awful, would you trust your own taste buds or the researchers? So mothers, trust your instinct. I'll use this as an example. This bottle is like a baby's tummy, very small. If you have it on its side, it's easy for the contents to drip. But if it's slanted just a little, as you can see, then it doesn't drip. Same way it is with reflux. When you were pregnant, did you have more heartburn when you slept flat or when you slept inclined? So mothers, trust your instincts. And some mothers have been told that reflux is benign, it causes no problem. This is also not true. I work at the hospital where I see a lot of babies who end up having reflux and then aspirating. Aspirating is when they get food into their lungs and then they get sick and they have pneumonia. And so reflux is not innocent or benign. It causes problems in babies. I would also make another video to debunk the false claim that aspiration itself cannot cause SIDS. This is not true, and I believe the AAP should review and revisit those recommendations that aspiration cannot cause SIDS, because if the pathologists are not making the diagnosis, doesn't mean that aspiration is not causing SIDS. If all the pathologists are calling SIDS due to asphyxia, and even when they find food in the vocal cord, but don't want to call it aspiration because they don't know when the food got there, maybe before or after death, then they won't make the diagnosis of aspiration as a cause of SIDS, and they will say it's asphyxia, which is the fancy medical term for lack of oxygen. I know some mothers worry that a slanted position can cause their babies to slide down. In our own sleeper, the baby might slide down, but the baby's head remains elevated even though they slide down initially. In summary, what I'm saying is, mothers, babies should sleep on their back, but the flat position is not necessarily the safest position for your babies. Trust your maternal instinct. Do what's best for your own baby. The second most frequently asked question about the sleeper is the age limit. Babies can use the sleeper until 5 months of age and when they're able to roll over, whichever comes first. I would confess that for our own children, I actually used the sleeper until they were 1 year old, because that's the way they felt most comfortable to sleep. They wouldn't sleep comfortably sleeping flat. But I wouldn't recommend this. The CPSC is clear. You can only use it until the baby is 5 months of age. The third most frequently asked question is, can the sleeper be placed in a crib? And the answer to that is no. There's a theoretical risk that the baby could roll over from the sleeper and get lodged between the sleeper and the crib. So mothers could use the sleeper in standard size bassinets such as the Dream on Me bassinet or the Delta bassinet, or even as a standalone product, but they shouldn't place it inside of the crib. In summary, the three most frequently asked questions: is the sleeper safe? Yes. What's the age limit for the sleeper? 0 to 5 months. Can the sleeper be used in a crib? The answer is no. I would continue to make videos about parenting tips, such as the top 10 things you can do to prevent reflux in your newborn babies. And you can find these parenting tips on our website. Your baby's comfort is our mission.